Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hello and welcome back, everybody. Today we have with us Professor Catherine Crock, who I'm delighted to introduce you to, and I think you're really going to love this conversation. Welcome.
Thank you, Sarah. It's lovely to be here.
Yeah, it's lovely to have you. Tell us a bit about you.
I'm a doctor at the Royal Children's Hospital in Melbourne, and I've been there now coming up 35 years. And I work in hematology, so I look after children with leukemia and other serious illnesses, and I do their procedures, their bone marrow tests and their lumbar punctures. And that's really what's led me into a very interesting and creative and amazing career. It
Yeah,
happened by accident.
yeah. Can you tell us a little bit about the story that got all of your work in this kindness field started?
When I started, I had 5 young children and I was doing a little bit of part-time work and arrived to do the bone marrow tests and lumbar punctures and found that the children and the families were getting quite distressed by the procedures. And in those days, we weren't even really starting to talk about patient-centered care, but I sat down with a group of families and I said, could you tell me about the journey when you've got a sick child? What are some of the things that make that journey more difficult, and how could we make it easier for you and your child and your whole family? And they talked about some amazing things that they knew about the healthcare system that we, as the professionals looking after them, may not have realised. And it was things about waiting for long periods of time, no one explaining what was going to happen next, feeling uncertain, but particularly about the environment they were coming into. The sights and the sounds and everything in a busy hospital are really threatening for people who are feeling vulnerable and scared to begin with.
Yeah.
And so they gave me this idea of bringing music into those spaces and thinking about the environment when we're in it. My children were learning from professional musicians at the time. And so I tapped into their expertise and said, could you come in and give me a hand? And that was really the start of what's been my side interest that's become central, and that was bringing creativity into healthcare spaces and seeing if we could then help not only the patients receiving care, but the staff who are doing the hard work. And it's been really fun, Sarah, I'd have to say. So I've been able to work with some of Australia's most amazing composers and musicians. And what Hush does is we bring a composer in to a healthcare space, and it can be a busy clinic or it can be a waiting area, intensive care unit, inpatient psychiatric units, emergency departments, operating theatres. And I stand these creative people in the corner and just say, get the feel for what's going on here. It's been life-changing for some of those musicians who haven't ever been in that sort of environment, and then who use it as a springboard to do their composing of what sort of music might help us in those spaces. Yeah, ask me some more questions, but that's where it all started. It was from talking to the families and then them saying, let's work on this particular bit, which is the whole like sensory surrounds of coming into a busy healthcare environment.
Yeah, I just really love that. One, you took a moment out of your busyness to meet with lots of families to say, how can we make your journey better? Even that is such a kind act to perform as their healthcare worker, as their doctor, as somebody who may not even have taken the time to do that.
I suspect it was helping me too,
Mm.
because I was finding it pretty challenging to be restraining children in a soundproof treatment room and doing things to them that if it was one of my children, I would have been really stressed. So I think being able to think laterally and come up with some other solutions of ways to make that better really helped me. And I'd also have to say, it taught me quite a lot about the hospital system and about making change. So one of the biggest mentors that I had at the time was one of the anaesthetists. And I went round to anaesthetics, and the head of anaesthetics listened to my story and what we were struggling with in treatment rooms to try
Mm.
and do blood tests or bone marrows or lumbar punctures on children without adequate pain management. And he said, "We've got the expertise here. We've got the pain management experts. We can help you." And it brought two departments together that hadn't ever really worked together. And that was beautiful. So learning that we can bridge some of the silos in healthcare and work together to get a better solution for the families. So that was great that they had given us the help to be able to do these procedures more in a more relaxed environment for the kids.
Yeah. Yeah. So you said you had 5 children at the time, like your own children.
My own children, yes.
That's already an impressive and incredible story there. So at this moment, were you already like through and out the other side of being heme oncology?
Yes, but I'd had to take so many breaks because, of course, back in my day, we only had 1 year jobs, so there was no continuity. And if you were expecting, you just had to drop out for the next year or two. There was no maternity leave either. So, yeah, lots of gaps along the way. And
Mhm.
then really fell into this by accident when I was just in the right place at the right time and someone else was retiring. And I got this part-time hematology job, but
Yeah.
it really became like a journey in patient-centered care and how to make change with the patients and families every step of the way.
Yeah.
And we did some beautiful things together, small changes. Just even when we were bringing the children into the operating theatre for their procedures, one of the parents said to me, "Why do you bring 12 families in at 7 a.m.? My child's not done until 11:30. What about you stagger the admission times and we'll come when you need us, but we
Mm.
don't have to sit in a chair with a fasted child for many hours." Just really simple tweaks. And we started to do that. And instead of it messing up the theatre schedule, it actually made us one of the most efficient theatres in the system because, in actual fact, we were not trying to problem solve and calm people down quite as much because they weren't
Mm.
there waiting as long.
Yeah. There would have been pushback though. People have been doing this for decades the same way. No, we get our kids in at 7:30 because we've got to have all their papers done at the same time. And you would have had a lot of crusty, frustrated, but this is the way we do it. I'm just imagining because I came through the system 25 years ago myself, and I just know that you would have come up against resistance to these ideas.
To be honest, yes, there was, and exactly what you're saying was said to me. One of the things that was said was, "Nobody's ever complained, and you're
Mm.
stirring up the families and you're making them complain." Now, in fact, the families were so incredibly grateful and they were just beautiful and constructive in their feedback. So it wasn't a complaint session. It was, "We've noticed this. I
Mm.
happen to work in business," one man said, and he said, "You couldn't run a business like this. Treat us with respect, give us a pager and send us to the park, and we'll come back when you need us." They can do that in the pizza shop. A lot of it, yes, I did get some pushback, and I think I was in my 30s and very eager beaver, keen on all these changes, and maybe did go a little bit fast at times. But it made a whole lot of sense when you were working with the families and then seeing the results. So often, one of my techniques would be to say, "Why don't we do a 6 week pilot on that?" And people are not, they don't arc up really about doing a pilot. And so we did a pilot of staggering the admission times, and it seemed to work really well. And then it just stayed. That would be a tip. If you're having
Yeah.
some pushback with something you want to change, try doing a small pilot study on it, and off you go.
Yeah, I like that because then you're not saying, no, we're changing and you have to comply. You're like, can we just give it a whirl? Just a
Yeah,
little turn.
exactly. Yeah. And we would tweak it as we went. If something didn't quite work, then we'd try it slightly different way. But yeah, I just loved the constructive help that we got from the patients and families. They really got on board with, "We want to make this better, all of us together." So that was
Mhm.
really fun.
Yeah. When you were working with the staff that had been looking after children in the soundproof booth and doing these procedures on children for years and years, what do you feel like the morale or the vibe of the staff were in that before picture?
Look, I think we had quite a lot of problems with the culture, and the vibe wasn't really one of, I'm excited to come to work. In fact, I have interviewed quite a few of the nursing staff who were junior at that time, and the idea of having to do painful things to children repeatedly and to be part of the holding them still so that we could do what we needed to do, that was very traumatic to them. Several of them actually left oncology once they'd done their grad training and have since moved into other fields and said, I was influenced because I really couldn't cope with the trauma that was going on in that room and being a part of it without having a voice to say, I don't want to be doing this. In fact, at one stage, one senior staff member said to me, the problem with now doing the procedures in the operating theatre and the children being off to sleep is you're de-skilling the nursing staff and they won't know how to restrain children. And that I found interesting from that person's point of view, that they
Mm,
must have cut themselves so much off from what trauma was actually going on in that room that they
yeah.
felt some people were going to need the skills of restraining children.
Yeah. Okay. So it's gone from this treatment room into the operating theater. So that's a really big change for a system because that's a whole lot of different people involved, different scheduling involved. So that's actually taken quite a bit of infrastructure change right there. Yes.
25 years ago, the infrastructure change wasn't that hard to move.
Got it.
We're actually at the moment about to be moving back into more of a ward area, but we're
Yeah.
bringing the anaesthetic team with us.
Yeah.
We're bringing the whole team so
Yeah.
that we're maintaining the safety and maintaining the excellent pain management
Yeah.
um, techniques.
Yeah.
So what I've really enjoyed is working with anaesthetists and
Mm.
watching how particularly pediatric anaesthetists are so good at working with each individual child and family and making sure that the journey's as smooth as possible.
Yeah. From your own personal perspective in terms of your before and after in the things like the harm we do to ourselves in medicine, the trauma of torturing small children, not torture, that's probably the wrong word, but doing things to children without the anesthetics versus doing this after. I can imagine we talk to junior staff all the time and they witness things that they think are incredibly mean towards patients and they don't feel like they have a voice. They really
Mm.
just are impacted by that, but not in a way that they think they can impact change. Whereas you said no.
Yes, I said no, but I think the music really made that a bit more of a gentle no. And let's look at the whole setting. So I think that helped us to start to have some conversations about what this really meant to all of us. And it has meant that we've been able to build a team who are thinking about the environment that we're in and how this is affecting us on a daily basis and how we can continue to keep improving. It actually opened up a way that we could talk about things like how are you feeling in a busy team environment, say in an operating theatre? How are we all relating to each other as a team? And where does kindness actually fit into that? And when I first started talking like that, it was a little bit unusual and I think a little bit fringy, but now it's quite an everyday thing that we set up our team each morning, and we're a different group of 10 people each morning who've never worked together as one team. I think they might call it like a flash team. We come together, and in the first 10 minutes, we get to know each other and we can talk about things like how's everybody feeling? Has anybody got any issues you'd like to raise that might impact how you're going to be able to do your work? And to begin with, I'd be the one who would say, look, there's some stuff going on at home, and I'm really worried about one of our kids and might get a phone call from the school. And if I do, please excuse me. And they would say, look, we're a team. We're going to be together looking after you and we'll watch out for you. Because, of course, they know I've got to check intrathecal chemotherapy and I've got to be able to procedurally be on my game and having the team have got your back when you're not at your absolute best has been amazing.
Oh, I really like that. That really spells out kindness towards ourselves as a team and that strengthening of that flash team. So as you've never worked together before, so we know that already in the literature has an impact on the performance of this team in a crisis, right? So even places like emergency departments, your flash team, the ability to say, who are we? What do we need to think about today and how are we together as a team and can move forward together is going to be so much closer to that safe point of a collaborative working well team.
Yeah, exactly. And we keep innovating and changing and doing different things in that huddle. We've recently added what we call a safety question at the very beginning. And that came from one of my daughters who's an engineer. And she said, we start every meeting with a safety story. And it doesn't even have to involve the room, but it raises everybody's awareness of safety. And so we'll just say, is there anybody who's got something they'd like to talk about? Someone might say, as I was walking to work, I saw a manhole cover and it was twisted and somebody might have fallen
Mm-hmm.
down. So it just makes you think, oh, look around the environment. Is there anything that we should be careful about today? And any of those conversations that you can bring in and just change the vibe actually quite energizing for the team. And you can watch everybody get a little bit more curious and a bit more interested in what's going on in the morning. Another example of something that is I really enjoy is we often have a medical student or a new nurse in the room, and to be able to welcome them and make them feel they are part of this flash team, it's actually quite exciting, Sarah. So one day we had a grad nurse and we introduce her and she says, it's only my third day here, etc. And we started explaining what was happening to each of the children and what we were looking out for and where she might fit in and be able to help. So we do the theatre list. She ends up coming for a couple of weeks. And so she's with us on and off over those 3 weeks. And at the end of that time, she was a fully functioning member of the team, helping the families back out into the waiting room, setting up the trays, helping us spread the bone marrows, packing up, etc. And she came to me and she said, oh, I wondered if you'd write me a reference. And I said, oh, absolutely happy to, but I'm a little bit surprised. Normally, the medical staff wouldn't write the nursing references. Can you explain? And she said, when I've been in this room, I feel absolutely fantastic. I'm at my best and I'm performing really well. In some of the other theatres, they stick me in the corner, they make me feel like an idiot, and I haven't actually been able to function. And I know that I'm not going to get a good reference. And I thought lifting somebody up to their absolute best in that team is a massive joy and a privilege. And
Yeah.
I'm not quite sure why we don't do that for everybody.
This focus on kindness as a central core of what you do and then spreading that outwards and saying you're valued here, here's how you can be helpful is such an amazing opportunity for your junior and new staff. And that it is unique and unfortunately not unique, but unfortunately not widely used.
Imagine how much more you get out of every single person in the room when that's happening.
So,
I just sometimes sit back and watch the team, and it's this well-oiled machine, and they're all just slotting in, and somebody's helping someone else over here without even being asked. And the families, in fact, when we do family surveys, they say we feel safe and secure when we come here. That's like the
yeah.
gold standard. That's where we're aiming, really. That's just marvelous. The
Mhm.
reason I got so passionate about the kindness stuff was in 2010, I traveled on a Churchill Fellowship, and my fellowship was around patient-centered care and patient safety because I was struggling to get the patient-centered care side of things to really stick. People were still giving me pushback about why do we need the families on this committee or why do we need to ask them their advice on everything. And so I thought if I link it to patient safety, then that's obvious. So I'm
Mhm.
traveling the world talking to patient safety experts. And as I was meeting them all, I came to this realization that actually the biggest patient safety risk is how we all treat each other. So if
Mm,
we're not treating each other with kindness and respect, and we're not looking after ourselves, it's pretty much impossible when some eager person like me comes up and says, and I want you to do patient-centered care and bring the families in. People, I think, were just going, we can't. We're at our limit. When you're really looking after yourself and your team looks after you, you can go that extra mile. Not what I'd say the extra mile, but you can close the loop and bring the families in as well. And it all makes perfect sense.
yeah, yeah. So if you're being treated well and you're respected and there's kindness from others at you and you've got kindness towards others around you, then you may have more capacity for those also coming into that space.
Absolutely. I'll give you another example. So, as well as doing the bone marrow tests and lumbar punctures for oncology, I was also asked if I could do lumbar punctures for the children with spinal muscular atrophy, who often have spinal deformities and quite difficult lumbar punctures, but they're needing to have an intrathecal treatment every 3 months. So the neurology department sent the first patient along for me to do this lumbar puncture on a young lady who was about 13, and she was severely disabled from her spinal muscular atrophy. And I, at this stage, didn't know a lot about this condition, neither did my team. So this girl could only communicate by blinking. And her parents came into the room with us to manage the BiPAP machine that she needed for her breathing. So we asked a lot of questions. We asked about how to position her and where the parents would like to stand to help us, etc. Did the lumbar puncture. It went successfully, and the parents were absolutely overjoyed. They took a photo with the team, and it was all just beautiful. I got a phone call from the head of neurology after that procedure, and she said to me, could you just explain what went on? Because we've called security on that father more times than we would like to say. Pretty much any time he has a contact with the hospital, the security need to come. And it was really interesting because I was able to say, we just did patient-centered care. The parents were obviously the experts, and we
Yeah.
brought them right in as part of the team, and we worked together seamlessly. And if you think about it, Sarah, the huge cost of every time we call security, that is
Mm,
not a small thing. That's a big thing for the people involved and anybody who witnesses it. Know
mm,
that. Yet, quite simply, a team that is focused on bringing that family in and listening to their expertise, it was just beautiful.
yeah. Wow. One, I'm a little bit shocked they didn't tell you that before she arrived. That just be heads up.
In a way, I'm glad they didn't. I've certainly had that happen too, that someone will say to you, oh, watch out for that parent, they're difficult or they're something. And you
Mhm.
go in with a preconceived idea, and it's quite hard to push that aside and then just meet them person to person and do the best that you can for that person in the moment.
We teach our learners about bias, your bias, when you're seeing patients in emergency departments, or you've got what the triage nurse has said, and you've got to make sure that you take that into account, but don't let it bias you, and
Yes.
how we have to do this introspection before we do patient management because we've got all these biases of our own
Mhm.
personal biases, what we've been told by the staff, what the story has been from the student doctor, like all of these things pushing on us. And I can just see how this functional team that you've put together, the environment you've created, and this was just a standard patient
Mhm.
to some new needs. So you were super curious about how to do this well for them. And they just found it such an amazingly helpful experience from the family's point of view.
Yes, it really is fascinating, isn't it? The interpersonal side of healthcare and what we do. Well, one of the other things that the Hush Foundation has done is written three theatrical plays about culture and behavior in healthcare. And we've been putting those plays on since 2012. And watching an audience see the drama of some real life situations played out, and then be able to have a facilitated discussion about it has been quite extraordinary. And one of the plays is about medical error and when things go wrong and what some of the culture and things behind the scenes might have been that led to
Mhm.
terrible things going wrong. Not listening to patients and families, not respecting your colleagues, bullying of junior staff, which unfortunately does still go on by some of our senior colleagues. But we've gathered the feedback from all of these audiences, Sarah, and it's given me a snapshot of hundreds of organisations and organisational culture, and gave me quite a concern about the culture, the crisis in how we do treat each other. And I talk about it quite a lot because that has struck me that the time has come. We all need to really take responsibility for this and make sure we're doing something about the culture wherever it is that we sit in the system. And so, really, the whole kindness movement, which we now call the Gathering of Kindness, started in 2015 out of this feeling that we really need to get together and think about what's a kind health system.
Mm.
Because at
Mm.
the moment it's not particularly kind to the people working in it. And
Yes.
as I've said before, if you're not feeling the kindness from the people around you and from the organization that you work in, it's very hard to show kindness to patients and families to the extent that you might otherwise be able to do.
Yeah.
So to me, this is really the big picture. Let's all get together and think about this kind health system and what's our part to play in building that. So Hush runs a gathering of kindness across probably a week or two of November every year to try and raise awareness. And then we've also built a kindness in action program. So an online program that is short, sharp, and to the point, and feed that out across the rest of the year to keep the conversations going and keep that word kindness in whatever you're doing. Just make sure that lens is there in whatever you're doing because we can see it makes such a difference when you get that right.
Yeah, absolutely. Can you go back to you were noticing the problems, you took yourself up to the anesthetic department, you've started to think about how we could do things differently and asking about pilot projects. Who came with you on that journey? Or did you feel like this was, I'm the change agent and I'm going to push myself against the system until it works? Or did you have other members saying, I agree, I want to do this too? How did the gathering begin?
I think because I like connecting the dots and connecting people, I certainly didn't want to do any of this on my own. I'm basically very shy, and so I needed people to come with me. And it was really a matter of strategically talking to the right people and getting some mentors. And I am one of those people who, when I walk around the hospital, I know everybody. I like to say hello to everybody and how are you getting on and keep those connections going. And I think that really helps because I had a band of people who were in the right sort of places I could say, can you help me with this bit? One of the other things the parents said was, our children are immunocompromised and we're told to avoid people with coughs, colds, and diarrhea. Yet you write me a pathology request slip and you say, go down and sit in pathology collection for an hour and a half with people with coughs, colds, and diarrhea. It's freaking me out. It doesn't seem to make sense. Why couldn't the pathology person with her trolley come up to the oncology clinic? But of
Yep.
course, then you find there's no room up in oncology for them to do it. And so I happen to know the lady who allocates the rooms, and we talk about it together. And next thing we find a room. So it was problem solving with the right people helping me
Yep.
at every step. And yeah, those connections as you go around your day are just, they're energizing to begin with, but also
Mhm.
then you can get things done.
Yeah, yeah. The neurology department that were so fascinated by how you turned around that case for them, did they then come ask more questions about how to do that with the team?
Yes, and I've been to get, yes, I have been to neurology staff meetings and things now. And yeah, it was great to see a department who hadn't really been thinking like this then go, oh, we get that this can make a difference. Yeah, and they've been like big advocates ever since. That's been really good.
Yeah, I just see the ripples effect as you start to have impact in one area. Even the music. So tell me, you started having music in the spaces of the hospital. Tell me some of the stories that happened from that experience coming to life in your hospital.
Look, it's really been beautiful. It's taken off really as an international thing now, the Hush Music program. And that started from our hospital. We had some pretty famous musicians involved. And the hospital, when we did the first music album, said, will we do a little like a media launch? And so we did a media launch, and the radio and the TV and people came. And so we started to talk about it. And it gave us a bit of a platform that this is why we're doing it, and this is the impact that the music is having, helping us to get these children off to sleep more smoothly. They wake up better in recovery. The rest of their oncology journey for the day is more smooth because everything's been nice and calm.
Hmm.
And then lots of people, Australia-wide and internationally, started to get interested. And what had started off as I really only needed, say, 1 hour of music, we've now been for 25 years producing a different Hush album every year along different themes and different musicians each time. But it's been an ongoing conversation that I think has influenced a lot of people. We had one young lady recently who she's now in her early 20s. She had leukemia as a 3-year-old, and
Hmm.
she came back to our 25-year reunion for Hush, and she said, I'm now a musician and a singer, and I was influenced by the little headphones that we would put on. And she had the
Yeah.
Discman with the
Yeah.
music, the headphones, and that has actually influenced her because it kept her calm through her cancer journey. And now she's a musician. So that's
Wow.
beautiful.
That is so beautiful. I love that. Is there anything we haven't spoken about that we should talk about before we close up today?
Look, I'd just like to encourage people to get involved. They can go to our website, hush.org.au. Certainly, if you're in a healthcare environment where you think kindness in action would be really handy, give us a call, get involved, help us build this movement, because I think the more we have these conversations, the easier they become.
Yeah. Yeah, I can imagine that initially there's going to be a bit of resistance because perhaps the reason you're bringing it into an organization is because you're not seeing a lot of kindness, or you're seeing areas where we could improve kindness. And so you're potentially feeling a little bit out of sorts if you're starting to introduce, hey, we could do something fun and nice for each other.
Yes, but you'll be amazed actually that people get really enthusiastic about this. And kindness is something we do all understand. It's
Mm,
not, it's not going to be a difficult concept. And what you said before about the ripple effect, that happening so quickly. It only
mm.
needs to be a small act of kindness, even if you witness it, and you're way more likely to go on and improve your own team.
Yeah. No, I'm encouraged by this conversation. I think that I really am so thankful for what you did, and for, even as a new staff to the area, just notice what you weren't liking or enjoying about your work and saying, no, we can't have this happening. This is not sustainable in this way. I can't do this to children in this way for the rest of my career. Who am I going to talk to? How do I make something happen?
Yeah, exactly. And get good mentors around you. That's
Yeah.
always so important.
And thank you for the resources. I'm certainly looking forward to checking them out as an opportunity to influence the spaces that we work.
Excellent. Thank you, Sarah. It's been so lovely talking to you.
Yeah, I love talking. I love this conversation. All right, everybody, have a wonderful rest of the week and bring kindness wherever you are.
Thanks.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.